Hello, my name is Huck Friedman. Today, I'm going to be walking you through my thought process and the steps that I took to complete a surgery on a fetal pig comparable to a surgery one would perform on a patient with spinal stenosis. Spinal stenosis is a disorder where excess pressure is put on the spine of a patient because of wear and tear or damage to the bone or surrounding tissue surrounding the nerve fibers of the spinal cord. This can cause chronic discomfort, and in order to fix it, bone must be removed and pressure relieved from the affected vertebrae. In this first image, we see how I position the pig in order to have easy access to the spine and in a way where both of my hands were free to work. The first step that I took was making a main incision along 3 to 5 lumbar vertebrae near the tailbone of this fetal pig. Here, we see the spinal cord and surrounding tissue after some fascia and tissue was cut away in order to reveal this initial view. In the next picture, we see how I cut away at some of the muscle surrounding the spinal cord itself. I was careful not to cut directly along the spinal cord, as this could have destroyed the nerves that emerge from the spinal cord so that signals can be propagated to and from the spinal cord itself. This eventually became a non-factor in this procedure. This will be explained later. In this next image, we see the thick ligament that runs along the top side of the spinal cord. Its whitish hue can be seen in between my Adson forceps in this image. At this point, what I was trying to do is remove surrounding tissue and expose this ligament so that I could then begin to whittle away at it and expose the vertebrae themselves as they were underneath this ligament. In this next image, we see from a much more top view the surrounding tissue that had to be removed in order to access the ligament and the vertebrae beneath. This was all in preparation of creating a clean and easily viewable spinal cord as the surgery progressed. My next task was to begin to remove the ligament and expose the vertebrae beneath. This is not super clear in this image, but will become apparent in the next two. At this point, you begin to see the dark red spheres as the vertebrae themselves. This dark red hue is the bone marrow, which used to house blood before this pig was drained. This took lots of work to expose, as the ligament above was very dense, and being careful with the surrounding tissue was one of my priorities at this point in the surgery. In this next image, I began to use a Whitlander retractor to keep tissue away from the vertebrae so that I could work on them cleanly and have both hands to access and stabilize the spinal cord itself as soon I would begin to remove parts of these bones. This next image shows me using Kelly forceps to stabilize lower down on the spine and a bone rungor to begin to apply lots of pressure to these vertebrae and start to remove them in order to reveal the spinal cord beneath. The parts of the vertebrae I was removing are called the spinal processes. These make up most of the bone mass of each vertebrae and cover the spinal cord and spinal fluid from the rest of the body, and these processes lay in between the main ligament running above the spinal cord I was referring to earlier and the spinal cord itself. This next image is an after picture of after I used the rungor to remove 2 to 3 of these spinal processes. At this point, I realized that I had to start cleaning up these areas so that once the last of these spinal processes were removed, I would have clear access and view to the spinal cord itself and the membrane that surrounds it, called the dura mater. This next image is another one similar to the one before it, but here I had removed slightly more bone, and what I thought was a spinal cord is what can be seen here, right below my lower forceps. Here, we see the after picture after these spinal processes have been removed. The translucent membrane and a long white fiber can be seen at the very center of the incision. This being what I found after removing the vertebrae raised 2 alarms. For one, I did not see any nerve fibers jutting out from this main cord, making me think that this may be just another piece of connective tissue or membrane on the dorsal side of the ribs rather than the spinal cord itself. I was also worried that this white line running along this membrane was too thin and could not have been the spinal cord itself. In order to solve this, I slit the membrane right next to this long white strand. This was very concerning because beneath this membrane, I found feces. This made me think that I had actually cut into the main cavity of the pig, where organs like the small intestine and kidneys are. This was very concerning, as I began to think that while removing the vertebrae, I had actually destroyed the spinal cord itself and just cut right through past it. After this discovery, I wanted to try to identify the sciatic nerve, as the sciatic nerve stems from nerve fibers jutting out from lumbar vertebrae. I wanted to track the sciatic nerve down the back of the pig's femur. I suspected to find this here because of the sciatic nerve's position in humans. This was very challenging for one reason. The leg and many tissues of the pig have connective tissue running all around. Because of this, it was hard to identify the sciatic nerve and differentiate it from any other connective tissue. One of the main downfalls, and why I believe this surgery was not fully successful, is the lack of imaging I had available. It was difficult for me to identify every part of the spinal vertebrae I was dissecting. And because of this, I had trouble completely identifying each step and exposing what I wanted to expose without cutting too deep or missing it altogether. This was also a concern when trying to uncover the sciatic nerve, which can be seen in this image right below my forceps, running parallel to where the femur would be, right behind it. At this point, I began to suture up the pig and finish the surgery. Here you can see me laying my first stitch along the top of my main incision along the spinal cord. This final image shows the suture finished and the spinal cord, as well as the pig's leg, sutured back together. This is the end of the slideshow. I felt as throughout this experience, I learned a lot, and it was very interesting to employ a multitude of tools to help me through this surgery. Although I feel as if the result itself was not a complete success, this was a good learning experience, and I have many more years to fine-tune these skills. Thank you very much for watching.